clinical aspect, managing hospice patients is interesting, and in my opinion, it really comes down to perspective. I think we need to really remember that hospice patients have completely different therapeutic endpoints than any other area of healthcare. And so as long as we keep that in mind and look at these patients from the correct perspective, it really changes the game for how we can manage these patients from a clinical perspective. I really see it as the pharmacist's role to make sure that we can get that medication on board with that patient regardless of how that patient presents. So essentially, having a good quality pharmacist or pharmacy team that these hospices work with is really critical, because that allows us to think outside of the box and incorporate things like compounding, different routes of administration, whatever we need to do to ensure that we can get that medication on board that patient, regardless of how that patient presents. Working with a pharmacist that has a lot of experience in hospice care, or is essentially a hospice specialist, is really critical, because again, that puts managing these patients in the right perspective. We have different therapeutic endpoints in hospice than we do in any other area of healthcare. We're no longer trying to cure a disease. Now we're trying to manage symptoms and really focus on increasing quality of life. And so working with a pharmacist that's used to those therapeutic endpoints really allows us to better manage hospice patients towards their individual goals versus goals that we would typically see in all the other areas of healthcare.